Well, it seems like headlines are different and screaming every single day, especially earlier this year with the passage of the One Big Beautiful Bill Act and all of the changes, miscommunication, misunderstanding about that we're going to break down in a future video. But another big thing that you're going to be hearing about soon is changes to Medicare. And I know if you're like me, your health insurance is the last thing that you really want to think about. And whenever there's a change, all I think about is how big of a headache is this going to be? Well, to help break down some of the changes this week on the Happy Retirement Show for what you need to know for open and annual enrollment periods, what's going to be different about 2025 and why now is the best time of year to get that Medicare review. We've got a special guest joining us, Alex Sieler. He's our Medicare advisor, part of our team here. Alex, thanks for being back again this week on the Happy Retirement Show.
Absolutely happy to be here and happy to help the folks that are listening in.
So tell us, Alex, what is different this year about Medicare, and why does this year is a good year for people to get a review?
Well, perfect. Yeah, great question, Colin. And as you know, and those of you that have listened in on a couple of these videos, you know I'm a talker. And Colin always tells me, "Okay, Alex, you got about 5 minutes, right?" And it's a lot. It's funny because it's so much information to cover all the time, just because it's such a moving target and it's so situational to the individual. And here's what I would tell you, folks: the reason why this year of all years, truly, the reason why this year of all years is a year to get a review, get a second opinion, get a review, whether you end up making a change or not, is because there's a lot of different factors actually that's weighing in. So there's no, and let's just get down to it. Let's kind of get to the brass tacks. It's no surprise that if you turn on the news today, Medicare and Social Security is a hot topic, right? Things that are need to be changing, and why. And what I would agree with is every year we get hit with, okay, there's going to be all these changes to Medicare, and maybe only about 5-10% of them coming into effect. And this year they're going, well, wait a minute. There's a couple different things. One, and I hate to be that guy, outside of just normal inflationary items that are causing for price changes and coverage changes, whether it be Medicare supplement premiums, prescription costs, deductibles on plans. I'll tell you, folks, COVID, believe it or not, we're still talking about that today in terms of insurance. Usage was at an all-time low during COVID, during 2020 and 2021, believe it or not. You would have thought it was at an all-time high. It was at an all-time low. And we have data we can go into at some point if we ever want to do a long podcast together on that. On people just were not doing their elective surgeries, that were putting things off, and now they're all coming back in full charge. And then the third biggest factor is, I'd tell you, we're in year 2 of a 5-year stretch of the boomers coming in. So 35 million people on Medicare today, and we are on year 2 of a year 5 stretch. And actually this year, next year, and the following will be the 3 years of the 5 years of most amount of people aging in. So what's happening is there's the Medicare supplements, there's Medicare Advantage, and there's prescription drug. They're all going through their shifts. They're all going through their changes. And that's why of all years, this year and next year, it's imperative to sit down with a local advisor like myself, anybody you maybe already have trusted experience with, whatever it may be. Call us, talk to us, okay? This is a year where the changes, you will most likely be impacted by some of those changes. Let us do that review for you. In a given year, what do they say? It's anywhere between about 8 to 10% of the Medicare population is impacted by changes that happen, whether it's their network, their insurance plan, somewhere in between. This year, I'm hearing upwards of 40% will be impacted in some way, shape, or form going into 2026. Massively. 35 million people on Medicare, 40% of them upwards to see change. So that's what I would tell you today, Colin, is of all years, give us a call. And the noise is only going to get louder. The marketing is going to keep going up. We don't necessarily participate in that, but rather than get confused by someone sending out a letter that's a little bit confusing, then they're mixing terms, whatever, just get you to pick up the phone. Rather than do that, go through a trusted resource like Colin and his team and get them connected with us, and let us just give you that quick review and give you, like, I like how you say that, the sign of approval.
It's one of those things where, just like you in medicine, if you were going to go to see a doctor for a major issue you were having and you're going to have big surgery, and you decided you wanted to get a second opinion, not because you don't like the first opinion you got, but you really just want to be sure it's the best fit. Well, you can't get a second opinion from the person that gave you the first one. So one of the reasons we like being and connected with Alex as a resource for our clients is Alex has access to all Medicare Advantage providers, supplement providers. He has access to everybody, and he gets paid the same regardless of what you go with. And it doesn't cost you a penny more to work through a Medicare advisor like Alex. So you can have access to everybody for the same price, and he has no incentives other than to help you get the best coverage. So go ahead, and if you'd like to get connected with Alex or his team, reach out to us at ghwealthadvisors.com. Click the link in the description below, or pick up the phone and give us a call at 513-984-5999. Now, Alex, you were telling me before we hit record about a situation where you were really able to help somebody save some serious change. How could you help her save so much money?
Yeah, and this is where it comes down to very situational, and every year, and folks, I'll be the first one to tell you, and this is why. First of all, we don't sell insurance. We educate on the insurance side, and I know that sounds so cheesy, but the reason why it's so imperative is because, honestly, changes that you go through, it's just done all through education. And so, as you know, I'm here in Omaha, Nebraska, and Nebraska is a very rural state. We are 80% of our population truly is all along the east coast of the building, all along the east coast of the state, and it's along the river, and it's really made up about three cities: Omaha, which is by far the biggest, Lincoln, and then a place called Grand Island. Other than that, when you and truly pretty much put your finger right in the middle of the map, that's where Omaha's at. You go all the way left, go all the way west. It is as rural as it gets. Lots of land. And so I have a lady who I worked with, and she's out of a city called McCook, which is a very small rural town. And she's been on the same United Healthcare plan for years. And like many, she just goes and gets overwhelmed. She goes, "Oh my gosh, all the marketing, all the letters, all the phone call is just overwhelming." It's kind of a forget about it, right? Like almost passive aggressively forget about it because you're just so overwhelmed. You don't want to get confused with it. Her son called in and said, "Hey, I've seen some advertisements of yours. I've seen some videos of yours. I'm really wondering, can you help me sit down and look at my mom's health insurance? It's insane what she's paying now versus what she had, and her health hasn't really changed a whole lot." Well, really what it came down to, she was on a plan that was really old. It was really old and altered. It's kind of one that, to be honest with you, I couldn't even write it today if we wanted to, because it's just not offered. It's kind of off, and she just ignored everything. And yeah, sitting down and talking with us, between her co-payments and her prescription costs, I think we saved her right about $11,500 a year. And all it took her was a 30-minute review.
So she saved almost $1,000 a month on her health care by sitting down with you for 30 minutes.
Yep. And of that 30 minutes, 15, 20 minutes of it was her getting to talk to me, my three children, and me plugging her information in the machine and going, boom, you like the kind of coverage you have? Great. We can get you the same coverage. Here's the new cost of covering it. And
wow.
Within 30 minutes, we had her, again, that's pretty significant savings, especially in a world like today with inflation and where everything's going. 30 minutes to save $12,000. I don't know what your hourly rate is, but that's pretty good if you ask me.
Well, absolutely. And Alex, that's $12,000 a year. Hey, if I can save somebody $12,000 over a couple of years in taxes, I still consider that a victory. But to save $12,000 a year on your health care, that's, in my opinion, money You need the service, but that's just money going extra out the door. So take a second. If you're listening today, don't put it off. Don't wait. Just set up a review. What's the worst that could happen? Maybe you find out what you've got's great. Wonderful. Awesome. Wouldn't you like to know that? Or maybe you find out that you're overpaying and could save some money. Wouldn't you like to start saving that money sooner rather than later? So go to ghwealthadvisors.com or pick up the phone and give us a call. We can get you connected to Alex, who's our Medicare advisor and is part of our team at Grayhurst Wealth Advisors. He helps people all across the country, and he's out of Nebraska. We're out of Ohio. But he's been such a great resource that we figured let's find the best. And we're certainly have had great feedback from our clients about Alex and his service. We appreciate you joining us here on the Happy Retirement Show, and anything we can do for you. Any questions, go to ghwealthadvisors.com. Watching on YouTube, click the link in the description below, and we'll see you next week. Bye-bye.
Start building a more secure future for you and your family. Take the first step toward financial clarity by scheduling a no-cost, no-obligation consultation with Grayhurst Wealth Advisors. See if we're the right fit for you by scheduling a consultation. Call us today at 513-984-5999 or click the link in today's show description to get started.